Infertility affects millions of couples worldwide, often causing emotional distress and strain on relationships. It is defined as the inability to conceive after 12 months of regular, unprotected intercourse. Many factors can contribute to infertility, including age, lifestyle, and underlying medical conditions. While modern medicine offers various interventions like IVF and medications, these treatments may not be suitable for everyone and can come with significant costs and side effects. Many couples seek alternative or complementary approaches to address infertility. Traditional Chinese medicine, with its long history and holistic perspective, has gained increasing recognition as a valuable adjunct therapy for enhancing fertility naturally. Traditional Chinese medicine, or TCM, views infertility not as an isolated condition, but as an imbalance within the body's intricate web of energy, known as qi, and the interplay of yin and yang forces. TCM practitioners use various techniques, including acupuncture, herbal medicine, dietary modifications, and lifestyle recommendations to restore balance and harmony, creating an optimal environment for conception. TCM practitioners conduct thorough assessments, considering the individual's medical history, symptoms, and overall well-being. This personalized approach allows them to develop tailored treatment plans that address the root causes of infertility and support the body's natural ability to conceive. Acupuncture, a cornerstone of TCM, involves the insertion of fine needles into specific points along the body's meridians or energy pathways. According to TCM principles, these points correspond to different organs and systems, including the reproductive system. By stimulating these points, acupuncture can help regulate hormonal balance, improve blood circulation to the reproductive organs, and reduce stress, all of which can positively impact fertility. Research suggests that acupuncture may influence the hypothalamic pituitary ovarian axis, the intricate hormonal network that governs ovulation and menstruation. Studies have shown that acupuncture can normalize hormone levels, including follicle-stimulating hormone and luteinizing hormone, essential for egg maturation and release. Chinese herbal medicine is another integral component of TCM's approach to fertility enhancement. These carefully formulated herbal remedies contain a complex blend of plant-based ingredients, each chosen for its specific therapeutic properties. Depending on the individual's diagnosis, these herbs can help address various infertility-related conditions, including hormonal imbalances. Certain herbs can regulate menstrual cycles, improve egg quality, and support progesterone production, essential for maintaining a healthy pregnancy. For those with polycystic ovarian syndrome, or PCOS, herbs can help manage insulin resistance, a common underlying factor in PCOS, and reduce excess androgen levels, promoting ovulation. Some herbs possess anti-inflammatory properties and can help reduce pain and inflammation associated with endometriosis, potentially improving implantation rates. Section 5. Scientific evidence, TCM, and improved fertility outcomes. A growing body of scientific evidence supports the efficacy of traditional Chinese medicine in improving fertility outcomes. Studies have demonstrated that acupuncture, whether used alone or in combination with conventional fertility treatments, can really make a difference. For instance, it can increase ovulation rates in women with polycystic ovary syndrome, or PCOS. Additionally, it can improve IVF success rates by enhancing egg quality, boosting endometrial receptivity, and even reducing stress. It's also been shown to reduce the risk of miscarriage, especially in women with a history of recurrent pregnancy loss. And on top of all that, it can alleviate the side effects associated with fertility medications. Fascinating, isn't it? Common Chinese medicine patterns and their Western counterparts. In TCM, infertility is viewed as a manifestation of systemic imbalances, rather than a singular reproductive issue. Several common patterns are associated with infertility, each corresponding to specific symptoms and Western medical conditions. Here we provide an overview of the most common TCM patterns and how they relate to Western diagnoses. One TCM pattern is kidney deficiency, yang, yin, or jing deficiency. TCM overview. In TCM, the kidneys are the foundation of reproductive health, governing both pre-heaven essence, genetic inheritance, and post-heaven essence, life energy developed through diet and lifestyle. Kidney deficiencies, particularly in kidney yang, warmth and activation, kidney yin, cooling and nourishing, or jing, essence, are common underlying causes of infertility. Associated Western conditions, hormonal imbalances, including low levels of estrogen or progesterone, menstrual irregularities such as amenorrhea or oligomenorrhea, premature ovarian failure or diminished ovarian reserve, male factor infertility due to low sperm count, poor sperm quality, or erectile dysfunction. Common symptoms: cold limbs, lower back pain, fatigue, low libido, frequent urination, weak knees, yang deficiency, night sweats, dizziness, tinnitus, dry throat, and scanty periods, yin deficiency. Poor sperm quality or ovulation issues, often associated with aging or congenital issues, jing deficiency. Treatment would be to tonify kidney yang or yin, strengthen jing, and invigorate the blood. The goal is to restore the body's reproductive energy and support healthy ovulation, spermatogenesis, and hormonal regulation. Herbal formula, Yu Goi Wan, restore the right kidney pill for kidney yang deficiency, Liu Wei Di Huang Wan, 6-ingredient pill with Rehmannia. For kidney yin deficiency, Zhuo Gui Wan, restore the left kidney pill for jing deficiency. Another common pattern is liver qi stagnation. The liver plays a key role in regulating the free flow of qi and blood, which are essential for healthy menstrual cycles and ovulation. When the liver qi becomes stagnant due to stress, emotional strain, or poor lifestyle choices, it can disrupt the reproductive system. Associated Western conditions: stress-induced infertility, polycystic ovarian syndrome, PCOS, associated with irregular cycles, cyst formation, and an ovulation. Unexplained infertility, particularly in cases where stress is a major factor. Common symptoms: irregular or painful periods, premenstrual tension, PMS, breast distension, mood swings, irritability, and a sensation of abdominal fullness or pain. Treatment principle: move liver qi and relieve stagnation. The goal is to smooth the qi flow, alleviate emotional blockages, and regulate menstrual cycles. Example: treatment. Herbal formula, Xiao Yao San, rambling powder, is a classic formula to soothe liver qi stagnation and regulate the menstrual cycle. TCM overview. The spleen is responsible for transforming food into qi and blood, which nourish the body's tissues and reproductive organs. Spleen qi deficiency leads to poor blood production and may contribute to infertility due to insufficient nourishment of the reproductive system. Associated Western conditions: luteal phase defects due to poor progesterone production, recurrent miscarriage caused by a weak or undernourished uterine environment, PCOS with a damp and phlegmy constitution. Common symptoms: fatigue, bloating, loose stools, heavy periods, spotting between cycles, a pale complexion, and poor appetite. Treatment principle: tonify spleen qi, raise yang, and nourish the blood. The goal is to strengthen the digestive and reproductive functions, ensuring a stable environment for conception. Herbal formula, Gui Pai Tang, restore the spleen decoction for spleen qi deficiency with blood deficiency. Another common pattern found in infertility is blood stasis. Blood stasis can occur when there is poor circulation of blood, often caused by trauma, surgery, or chronic stagnation. It leads to infertility by obstructing the uterus and preventing the proper nourishment of reproductive tissues. Associated Western conditions: endometriosis, characterized by the presence of endometrial tissue outside the uterus, leading to pain and adhesions. Fibroids or uterine polyps which block conception. Ovarian cysts associated with PCOS. Common symptoms: sharp, stabbing pain, dark or clotted menstrual blood, irregular cycles, painful periods, and the presence of fibroids or cysts. Treatment principle: invigorate blood and remove stasis. The goal is to improve blood circulation and break up obstructions in the reproductive organs. Herbal formula: Giji Fuling 1, cinnamon twig and poria pill for blood stasis with fibroids. Some patients will present with damp heat in the lower jiao TCM overview. Damp heat in the lower jiao, reproductive and urinary regions, can lead to inflammation, infection, and blockages in the reproductive organs. It often arises from improper diet or lifestyle and can affect fertility by creating a toxic environment in the uterus. Associated Western conditions: pelvic inflammatory disease, PID, or endometritis leading to tubal blockage or uterine inflammation. PCOS associated with overweight or insulin resistance. Recurrent urinary or yeast infections that affect the reproductive organs. Common symptoms: foul-smelling vaginal discharge, pelvic inflammation, painful or burning urination, a heavy sensation in the lower abdomen, and oily skin. Treatment principle: clear damp heat, resolve toxins, and restore balance. The goal is to reduce inflammation and improve reproductive function by creating a healthier internal environment. Herbal formula: Long Dan Si Gan Tang for clearing damp heat. Case studies and research evidence. 1. Improving IVF success with acupuncture. A landmark study in Fertility and Sterility, 2002, demonstrated that women who underwent acupuncture on the day of embryo transfer in an IVF cycle had significantly higher pregnancy rates, 42.5% versus 26.3%. Acupuncture was shown to improve blood flow to the uterus and increase endometrial receptivity. 1. Treatment of polycystic ovarian syndrome, PCOS. A systematic review in Journal of Ethnopharmacology, 2011, found that Chinese herbal medicine improved ovulation rates in women with PCOS. Formulas like Giji Fuling 1 helped reduce ovarian cysts and regulate menstrual cycles, enhancing fertility outcomes. 1. Male factor infertility. A 2015 study in Andrologia demonstrated that men with poor sperm parameters who received acupuncture and Chinese herbal medicine showed improved sperm motility, morphology, and overall sperm quality. This led to improved fertility outcomes in their partners, especially in cases of unexplained infertility. Treatment protocols and clinical applications. Acupuncture protocol. Acupuncture is typically administered 1 to 2 times per week for 3 to 6 months to regulate menstrual cycles, improve egg and sperm quality, and optimize hormonal balance. Acupuncture points are chosen based on the patient's pattern diagnosis and specific presentation.
At Makari Wellness in San Diego, we understand how challenging and emotionally exhausting infertility can be. With over 20 years of experience, Michael Woodworth has helped hundreds of patients overcome infertility and associated conditions using the time-tested methods of acupuncture and Chinese herbal medicine. Our personalized, holistic approach aims to restore balance, improve reproductive health, and enhance your chances of conception naturally. If you're ready to explore effective and compassionate care, backed by years of expertise and real results, schedule your initial visit today. Let us help you on your journey to starting or expanding your family. Call or visit our website now to book your appointment at Makari Wellness. Your health, your family, and your future are our priority.